what people have to understand is pain is multidimensional. It is not just the physical pain that troubles the patients, how people accept their pain, okay? How the other patients, relatives who accept the pain, okay? These are the social factors, and ultimately the psychology of the patient. There are some patients who are, scared. There are some patients who have got a very high pain threshold, and there are some patients who have low pain thresholds. Once they understand that, we can help to deal with the pain in a much better way. So our department, like I said, it's not just me who is sitting here and dealing with everything, but I could be the first point of contact whenever you have some pain which you cannot understand, or maybe you have seen many doctors and they couldn't identify the exact cause. So it is my duty to basically help you understand your pain, identify the causes of pain, and if there is anything which we can do with non-surgical methods, we are very good at it. We use different technologies, different techniques to reduce your pain, and wherever necessary, only when it is necessary, not just because we have to put you through under the knife for surgery, okay? So we basically don't deal like that, okay? We understand the pain, try to use conservative methods, even if it is things like medicines and physiotherapy. That's absolutely fine for us. Our job is to see that you don't have many pain, whether it is in the acute phase or in the chronic phase. So the other problems that we commonly see is there are a lot of patients who have got shoulder pains, they have got knee pains, they have got the tailbone pains because they have fallen while cycling or maybe off the bike. They also have foot pains. We have various techniques, various different types of injections which will help you deal with the conditions. There are many conditions which are actually easily treatable. We can treat you almost like you have been suffering for 10 years, and then with 1 or 2 injections, sessions of injections, your pain is almost like zero. Then there are other conditions you are suffering for 10 to 15 years, and you have seen many doctors, and you think you have lost hope, okay, and then you are living a life in misery, okay? We can deal with it. We can reduce your misery, we can reduce your suffering, we can at least reduce the pain by 50 to 60%, which is, I think, more than enough. For a patient who is suffering from severe pain, even a 10% pain relief is like 100% for them. Okay, so we use a holistic approach, we use a multidisciplinary approach, and try to basically help you deal with your pain. We don't do something because we find that is the problem. We basically find the problem, make you understand the problem, and then basically understand the treatment that will be available for you, all the pros. Every intervention has some complications, some side effects, many benefits. If the benefits are more than the risks involved, then I think that's the best procedure. And if we think that that particular technique or procedure helps you deal with the pain with less side effects, then definitely that is the choice for you. None of the techniques that we use will cause long-term harm, okay? If at all it causes, it gives you a lot of benefits, okay? It does not cause many more harms. Otherwise, there is no point us starting this pain management specialty. Recently, we've had a case, a patient who had chickenpox at an elderly age, about 55 or so. So this patient had nerve damage because of the chickenpox, and he had extremely difficult pain, okay? It was troubling him, it was troubling his relatives. He also attempted suicide, okay? So these are the extremes. Some patients cannot tolerate pain, they attempt suicide. Unfortunately, he was unsuccessful. Then his relatives searched for me online, and they found that we have some techniques to deal with it. That patient came all the way from Orissa. So with a single injection, he is pain-free. It's been almost 2 months. He's back to his life. He keeps calling me once in a while, and he's so happy about it. That's just an example to give. There are many conditions like trigeminal neuralgia, extremely painful. We call it the suicide disease. God forbid nobody has that, but we can deal with it. We have done in excess of 50 patients, which is a high series. It is severe pain in the face, either the cheek, the jaw, or around the eye. So we have got a technique called radio frequency, where we numb the nerve which causes this pain, and that basically helps you with reduction in pain, and you will be off medicines almost like within a day's time. We also deal non-surgically with knee pains, depending upon the grade of knee repairs, knee damage. If you have grade 1, that means early stages of knee damage. Grade 4 is basically when you actually need surgery. Some patients actually think that getting a surgery done at grade 1 and 2 will sort the problems out. Okay, every surgery has its problems. We don't do that. If there is a conservative method, then we actually deal with it conservatively. Okay, we try with some injections, We tried with some medicines, to increase the lubrication within the joints. Okay, this is one thing. Sports related injuries, almost everywhere. Everybody thinks that you need to play sports to have this injury, but in our day-to-day lives, even things like jogging or when we are doing yoga, we might develop a strain or sprain. We have got a new technology called cryotherapy. It basically uses ice, okay, to reduce the intensity of your pain. Within a day or two, you'll be back to your almost normal. 90% of your back pains, okay, we're talking about back pains, do not need any treatment. Just a bit of medicines, rest, and some ice therapy, that is enough. Okay, you don't need to undergo surgeries for that. And those rest of the 10% of the patients, they need some, targeted injections. Okay, and only about 1% of this 100% basically will end up having a surgery. So if you go to the right doctor, at least you'll get the right treatment. We at Yashoda have taken time. We have coordinated all the departments under one roof. We have got physicians, neurologists, repeating again, we have got physiotherapists, we have got spine surgeons, we have got orthopedic surgeons. Well, I just gave a brief about what we do as a pain management team at Yashoda Hospital. If you have any queries, you can contact us at Yashoda Hospital Secunderabad. Thank you very much.